founder of GoodDoctors.Health. And today I'm probably talking about this topic today is probably one of my absolute favorites. And it's actually to the core of everything that I believe and I'm doing in healthcare. And that is whole person healing, a whole person approach to health. So let me just kind of start from a premise of, again, most of you who are familiar with me, I've been at this for a really long time. I'm decades into my career, and when you just see how things work from from within the system, and being behind all of the closed doors, and you're seeing what really does work, what really doesn't work, and one of the things that is probably the most frustrating to me is how segmented our healthcare system has gotten. And what I mean by that is you have all of these specialists. You have your cardiologist for your heart, you have your gastroenterologist for your stomach, you have your endocrinologist for all your hormone levels. And while that is amazing and that's very necessary and very important, one of the problems is it's gotten so segmented that now there's very little ability to integrate because the hip bone is still connected to the leg bone. And here's the problem is that all of these systems they interact with each other. And when especially as people are getting older and they have more and more health issues, they're having to go from one specialist to the next. And the communication, let me just tell you, the ability to communicate within all of these specialties, it's still lacking. It is not, there's a lot to be desired at best. So, with regards to all of these specialists, they're really, really great at their area. And I think that is incredible and that is awesome. And while we absolutely need that, the problem that we're running into is that in traditional healthcare, the specialist who is supposed to be helping you kind of quarterback all of this, the person who's supposed to be, your overall whole person is either your primary care physician or an internist or just a general family physician. And that should work. That should be enough. The problem is that now insurance, if you're going through and you're utilizing traditional insurance, insurance is starting to lower and lower and lower and lower reimbursement to those types of physicians and practitioners to the point where they get to spend very little time with you. Again, right now, national average is somewhere between 3 to 5 minutes, maybe up to 7 minutes if you're lucky. And they still have to get notes and documentation, all of that done. That's a lot. If you're trying to quarterback somebody's entire health in 3 to 5 minute office visits, that's a big order to fill, and it's pretty much almost impossible to do. Really leaves where those particular individuals only have just enough time to either write another script or send you to another referral. That's just about what that allows. So, in the context of having whole person health, whole person healing, and looking at from the way it's very, very difficult to get in today's traditional healthcare system. And even more important, okay, and again, that's a real issue, especially for those who you do have conditions that are crossing multiple specialties. So, like, let me give you a great example: Hashimoto's. It's a thyroid condition, and Hashimoto's is a thyroid condition that's which is endocrinologist, but it's really very heavily influenced by your gastrointestinal system. So now you have an endocrinologist who's trying to manage something that's very gastrointestinal. I hope you can see just the complexity that these individuals who have things like Hashimoto's are running into. So having this a whole person approach, which is everything that I have designed Good Doctors to do, is to look at you like a whole person. That's why we take your blood work and we go through all of the systems. We look at all the systems all at once, all at the same time, to see how is everything interacting. What is giving you problems here? What is what is working? What is not? And we go from there. But if if as you're going through and we have like enough problems already there with regards to the whole person approach, in the system, the specialists, then we have another area that we are physical, mental, spiritual beings. We are you really can't separate those. But yet that's a lot of how our traditional healthcare, operates. And by the way, if anyone has any questions, please go ahead, put them in the chat and whatnot. I absolutely love to handle and address, the things that are important to you. By the way, if you're watching this not live and you're watching it afterwards, please just put it in the comments, and we'll be happy to get you answers to your questions. So, with regards to a whole person, and that we are physical, mental, spiritual beings. And let me just say this: there's so much of I hear this all the time. It's all in our heads. This condition is just all in somebody's head. They've been told that. That used to be something that got said a lot. It doesn't happen quite as much as it used to, and I think that's a really, really good thing. But a lot of these different things are being delegated over into working with therapists and all of that, which is fantastic. And I'm really thrilled with what has been happening in the world of mental health, giving it the attention that it absolutely deserves. But we're still physical, mental, spiritual beings. And I was so impressed today. I talked with a woman who is the reason she was contacting me was because she's working with a therapist, and the therapist was saying, yes, we're doing all of this work, but we need to get comprehensive blood work. We really need to see what is happening under the surface so that it complements all the work that you're doing in therapy. I am so happy to see how progressive the therapy industry is getting, along with so many of the other functional medicine practitioners out there, who we are really working. We're just working we're working together to help patients get some really, really amazing results. So, and I want to tell you just a bit about this mental physical health connection. The reason why I want to look at connections from a physical standpoint first, physiology first, is because if you're feeling physically, if physically you don't feel good, it's hard to address the mental. It's hard to feel optimistic and encouraged and all the positive things if fundamentally on a physiological level you're just suffering. I want to give you a very specific example. And this was one of the first times this happened in my career. I had a woman, or actually her husband called in that he was bringing her in, and she had been dealing with some really, really severe depression for a very long time. And they'd done all the medications, they had done all of the therapies and they'd done it all for years, and she was only getting worse. And her agoraphobia was getting so extreme that she could not leave her house. She couldn't go see her kids play their basketball games. She was on disability from work, and even to get her in to see me. This was before COVID, and whenever I didn't have telehealth, they had to drug her just to get her in the car to get her there. Now, dealing with extreme anxiety, that's not necessarily, typically in my wheelhouse. But whenever I was talking to this husband, and he was just so desperate, and this was again many, many years early on in my career. Um, Whenever he was in Bruce, I was like, okay, we'll bring her in. We'll do what we can, and we'll just take a look and see what we can find. When we got her lab results back, which, mind you, if you go in traditional standard of care, if you go into a physician's office and you say, I have anxiety, they're typically not going to run any blood tests. That's pretty much the standard of care, because there's really not a blood test for anxiety. But when we ran her blood work, we found this woman was catastrophically low in ferritin, which is iron. She was so anemic. Now, when you saw her, it wasn't a surprise. I mean, she was gray. She had no color in her skin whatsoever. Now, she was also depleted in several other key nutrients, but that was the huge one. I mean, it was surprising that she was even really cognizant as little iron as she had in her system. So something as simple as getting her on the right iron supplement with a few other key nutrients that she was missing, and then some very, very basic changes to her diet, within about 2 to 3 weeks, her anxiety levels were down 50 to 75% with no medications. She was able to finally engage in counseling again to kind of deal with a little bit of the other issues that were there. And then within 3 months, she was back to work. She was able to attend her children's basketball games again, and she was functioning beautifully again. And it really came down to the combination of physical, mental, spiritual. We were addressing the physical there, addressing the core key nutrients that she was missing that were leading her to having such, I mean, this overwhelming symptomatology, which by the way, I've been doing this for a really long time since then. And obviously now I know what to work with. I'm going to tell you how cases, it is almost like, it's really, if you know anyone who has ever had like really extreme anxiety and agoraphobia with it, I don't exactly understand why that connection, but every single time, and I do mean every single time, there has been depleted ferritin. And that has been one of the linchpins, not the only one, but one of the key linchpins to being able to get them back and feeling amazing and feeling fantastic. So it all works together. But see, here's the thing is, I could have referred this poor woman out for years and years and years of counseling, and we still would have gotten nowhere without those core key nutrients that her body was needing. Put it all together, and she was finally able to get what she was looking for. Let me go ahead and address this question. Thoughts about psychedelics in the mental health space. That's actually a really good question. I don't mind addressing it here in this context. So, with regards to psychedelics, I do feel like they have their place, and I'm not completely opposed. At the same time, I don't think that this should be a first step either. And one of the things that I have absolutely been seeing and it 100% I am seeing where individuals are having really, really good results. My one hesitation is my philosophy is root cause, and lack of psychedelics is not the root cause for most of these individuals. So if you're following where my philosophy is, I always want to address physiology first. Physiology first. Let's make sure we have addressed everything that your body needs on a physiological level. So then these various coping mechanisms and these various other strategies and techniques have the most ability to work. And can I say, I've seen a lot of success. I've seen a lot of success going that route. Where I have been hearing a lot of with regards to using some of these other things, and I'm not opposed to it. I just really want to address the root cause. And if let's say somebody's root cause is that they have a severe iron deficiency, it doesn't matter how many psychedelics or whatever they use, it's not going to get better. So we want to address that. So that's just where my philosophy and where I come from a foundational standpoint, and that's how I work with my patients to work backwards to the true root cause of your issues. Again, whether they fall in the mental or physical category, I really don't care either way. We want to get to the fundamental root cause and make sure you have everything that you possibly need. And I give you one more caveat on this. So the body prioritizes essential functions over non-essential functions. So your heart, your lungs, your liver, they get first dibs in all the nutrients that you take in. And your central nervous system is really, really key. Let me say this, is very, very key to everything. So your central nervous system also gets like first dibs on nutrients whenever you're taking them in. So one of the things that we find is that we hear this all the time, like, oh, it's stress, it's being caused by stress. These people's problems, it's all stress. Well, that's true, but not true. See, one of the things is whenever somebody is stressed, it really their central nervous system uses up so much of their nutrients, so much of their resources, so many of the vitamins and minerals that are in their system. There's just not much left over. And so when somebody is dealing with anxiety issues and depression issues and just other, you put in that general broad category of mental health, it is even more important to fuel properly because you're using so many of your nutrients. And if you aren't fueling properly, you're going to be missing a big, big chunk. Um, you're going to be missing just a big chunk. Let me go ahead and look at this question here. Um, yeah, so I'm running the yeah. So with regards to there are, I am not. Here's the thing. I want to be very clear. I'm not opposed to anything that works. So some of the questions with regards to some of the different medications for anxiety and depression and all that. I'm not opposed to it. If something's working for somebody, I am. I'm a fan. Okay, we need help when we need help, hands down. My issue that I take is when it's not working. We can't keep doing, like, it's the definition of insanity, right? Keep doing the same thing expecting a different result. When somebody's not getting the results that they need, whenever they're taking all the things, they're doing the medications, and it's not getting them the health, the wholeness, the happiness, the joy that they're looking for, we need to take a different approach. I hope that I hope that makes sense. I hope that's just common sense. I would hope. So that's always where I'm looking at. I'm never opposed to trying something. I'm always up for, we got to try something different if you're just not getting the results. Now, what is that something different? Again, let's always look at what is the body asking for, because sometimes it's not obvious. And let me tell you, I don't know how many hundreds and thousands of these panels I do a year. I am still shocked by the things that are going on in people's systems. You'd think after so many years and so many people, if people could just tell me a symptom, I'd be able to tell them exactly what their blood work's going to look like. It is phenomenal. And it's getting worse. It's getting harder to do nowadays because of the internet. You can read all about all these different symptoms, and people start like self-diagnosing. So what's happening so many times when they're talking to me, they've already kind of self-diagnosed on a bunch of different levels. And then now essentially what's happening is I'm hearing their self-diagnosed version, which makes it worse because they're self-diagnosing. They're telling me what the what they've been reading. So then I'm thinking that same thing in alignment, and then I'm going to their blood work, and it looks nothing like what I would have expected. So, and that's again why we're getting different results, and that's why people are finally getting results after 10 years, 20 years of dealing with some of these different things, because we're finally looking at it from a biochemistry standpoint, which is just really exciting. So I'm going to be doing a lot of these lives once a day, at least during the week, to the end of the year, and then we're going to be doing bigger. I'm going to be doing longer, bigger topics about once a week come the new year. So I just encourage you, if this is helping or it's something that you're interested in, subscribe, like, be notified. Hit the bell so that you're notified whenever we're going to be getting into some of these different topics. I'm happy to just jump on and answer questions as well, because I know it can be really difficult to get a perspective. It's hard to get into people like myself, and so but anyway, so if you have any questions afterwards, please put them in the comments. I'm happy to help. But otherwise, we will see you again very shortly.